walk this outside because it's going to rain. Give me 1 second.
We'll be with you in just a second.
That's going to go crazy doing. All right, sorry, thought we were ready. Had to take a phone out of the room. Welcome to our third live Q&A. Today we're going to talk about scleral lenses and how we use those. Some of the things we may say today are going to sound redundant, but just bear with us because scleral lenses are used for all kinds of things. So let's start with, what are scleral lenses?
Yes, good question. So scleral lenses is a type of hard contact lens that we use for multiple purposes. You know, it's definitely, we use it to correct vision, but we can also use these lenses for diseased eyes, or even to kind of help us with our dry eye component. But it's a hard lens that sits on the white part of the eye. It's a lens that it's basically a bowl that we can fill full of artificial tears, and then when that's on the eye, it just keeps all the moisture that we need. But those properties of having that fluid there in that contact is what really allows us to use these lenses not only for vision correction, but for disease processes, and to help to treat dry eye, and to help to treat misshapen corneas. And
sure, working in optical, I hear a lot of feedback from patients, and we're talking about different options that they have with contacts, glasses, whatnot. So many people have said, I used to wear those awful lenses when I was younger that are hard and whatnot, and I know they're talking about sclerals or RGP lenses. So can you discuss and tell us why those awful lenses are no longer awful? Because we have a lot of testing and technology now, where back then it was maybe not as customizable as it is today.
Sure, yeah. And so most of the time what I think those patients are referring to is the small corneal lenses. Those lenses, when you put on the eye, they sit on the cornea of the eye. They do have a little space in there that fluid collects, but it's mostly your tear film, and that tear film's going in and out of that contact. And so for those lenses, especially when you first start wearing those, they're really uncomfortable. They do get better with time, but they're really uncomfortable at first. Now, what we're talking about today is a lens that's a little bit larger, and being larger, it sits on the white part of the eye, which is also called the sclera. Right. So that's how they get their name. But because it sits out there, there's very few nerve endings. It's very comfortable. Actually, if they're fit correctly, nothing's touching the cornea, which is where all of our feeling comes from when contacts are on us. We just keep that nice artificial tear fluid in there that's up against the cornea, and that's why they're so comfortable.
Yeah, and I think the RGPs, if I'm correct, you're kind of blinking over those, right? And that's where all that feeling is coming from, that you eventually tune out and don't feel
Correct.
anymore.
Yeah, you're feeling the edges of those. So every time that eyelid kind of opens and closes, it's kind of grabbing one of those edges. And although the eyelid will open and close across the scleral contact lens similarly, but because it's bigger, we just don't feel it as much. And it all goes down to, the lenses have to be fit correctly too. Right. Obviously, if you have a poor fitting lens, then it's just not going to be you're going to feel that. But as long as you get the lenses fit correctly, you don't feel these at all. I think we both can attest to that.
Oh,
since,
absolutely.
we both wear these lenses.
Yeah, no, they're fantastic lenses. I think most everybody in our office, minus like one or two who don't have issues with prescription or dry eyes, we all wear them. And there's just no comparison vision-wise to, I can put the same power that I have here on in a daily wear lens, and the vision is like high def versus like old school TV.
Yeah, your regular soft contacts seem like a standard definition versus these scleral contact lenses seem like high definition.
Absolutely.
And, once you kind of get used to that high definition, it's hard to go back to some of the other ones.
Almost like a filmy, like I'm looking through perfectly clean glass, or I'm looking through something that my dog rubbed his nose all over.
Right.
Okay, so rolling into that fit that you were talking about. So, it's not a one and done process. So what should patients expect when they come in as far as how the fit process works, and a time frame of, there have been times we've hit the nail on the head once. Sometimes maybe the second time, but it's not a one and done.
It's hard to get it one and done. So, the process of these lenses, are very custom. They're custom to the individual wearer. And so it's not like we just walk into the back room, pull a contact lens, put it on, and
Right.
it's like, hey, this works. These lenses, we actually use a computer software program that's going to take a topographical map, which is going to show the elevations and the valleys and everything across that corneal surface to allow us to design a lens that will fit over those surfaces to make sure that we're not touching anything, so that we have just a fluid interface that's touching the cornea, but also to allow us to get the edges to set down just right so that our eyelids don't feel it as they're opening
Right.
and closing.
Right.
And so we start with that topographical computerized map. We use that to pick a lens that we have close to what we need here in the office. We only have a very limited number of lenses in the office. So a lot of times when we're putting that initial lens on a patient, you're going to feel it just a little bit more. You may feel some edges, but again, they won't be painful because we'll be close enough to
Right.
kind of our fit on that. But we put that lens in that we have in the office, we put it over into the eye of our patient. The vision won't be great because we still need to figure out what powers we need in there. These just have kind of generic powers. They're not made for that patient yet.
Right.
So we do some testing, the better one or two, the things that we always love to do.
Yep.
We do the better one or two over those contact lenses to, judge what kind of powers we need to put in it. We also look at the lenses to see what curves do we need to change. There's multiple parameters in these lenses that we can change so that lens now becomes custom to our patient.
Yes.
And then we order that lens. It usually takes about a week to come in. They are, custom made. They're made to order when we order that. So it takes about a week to get here. And then we bring the patient back in and do kind of the same thing. Most of the time that first lens is pretty good. At least we can get them started wearing,
Enough
learning how to
to
take them
leave
in and
with,
out,
right.
correct. But usually we're going to make some changes. Now, like you said earlier, occasionally we'll get it right on that first one.
It's not common.
But it's not common. Normally it's 2 to 3, maybe 4 lenses, depending on what we're kind of battling. Are we battling a diseased eye? Are we just trying to do dryness? And then it also the vision comes into play with that, because there's so many different things we can do with our vision in correcting for distance while correcting for near also.
Yeah.
And so those things take little minor tweaks. But the companies that we use tend to give us about 90 days to perfect that fit. Right. So, as long as our patients are coming back for those follow-ups, we can typically get anybody fit in that time frame.
And I think too, because with our soft contacts, those sit directly on our eye, but with these hard contacts, we have solution behind that contact, which is also creating a magnification situation with the prescription. So you got to play that factor into it too.
Yeah, so
it's not so easy.
Right, the actual fluid inside the lens becomes a lens, and so it has a power to it in itself. So we have to take in consideration the power of the eye that we're working with, the power of the fluid, and then we compensate for the power. Which is
what makes it
lens.
A little bit more trickier than just pulling something here that's like perfect. You leave office and it's great, but with this we have other factors into play.
But it's well worth the little bit of time that it takes to go through to get that extra sharp vision and to have that comfort. For the whole day.
Oh, absolutely.
You put the lenses in and you kind of forget they're there. And
absolutely.
That's the...
I don't know if you remember when I had come to you, there was a viral trend of some sort going on TikTok, and this sounds so silly, where people were sitting in front of a fan and they were saying the ABCs. You had to see how far you could get through the alphabet before you blinked. And I came and I showed you the video where I sat there in front of a fan and didn't feel the need to blink through the whole alphabet.
Of course, because you didn't feel anything.
Yeah, because I was cheating. I had my Sclerals in, so nothing was hurting. But they are fantastic lenses.
That brings up a good point, though. When we're wearing these Scleral lenses, it's actually building a little bit of a barrier from the outside world to what your eyes are feeling. And that's where it's helping a lot in our dry eye treatments. Like we alluded to last week when we were talking, we use these lenses not only to hold that fluid, hold that moisture up against the eye, but we build that outside barrier so that, fan and air conditioners and just wind from outdoors and even, some of our patients who work in somewhat polluted environments like factories and that sort of thing, these lenses do a great job of keeping their eye health, in line and normal.
Hey, Dr. Schwartz. Hey, Mom. Okay, so did you want to show them our fit sets and the two different?
Sure, yeah. So primarily we use two different style of scleral lenses. Both of them are manufactured by a company called Valley Contacts. The Poseidon lenses are the lenses that we use for kind of our dry eye treatments. We use it for normal eyes, normal people. Even if you don't have dry eye, you can use these contacts. If you say you have a little bit higher prescription, or you have an astigmatism with your prescription, and soft contact lenses in the past haven't worked well,
Right.
this particular lens works phenomenal for that.
And when you say that, actually, my mom that I was just saying hey to, I've told her many times she's got to come in for a fit because she would do fantastic in these lenses. So, like you were saying, we're limited to what we have here in office. This is the fit set that they send us to start with as a base lens. So like you said, based off of the topography that we take and other factors, they'll come here and see which lens best fits your needs, and we'll go ahead and put that in. So it's not going to be a perfect fit. Prescription wise, it may not be either, but this is the base that they start on to then look at how it's sitting on the eye, how you're seeing with it, and then tweak from there to make that custom fit.
And with this set and our other set, we can handle about 90% of all of our patients. There's about 10% out there that we would just have to get something close, and then we would start an order to get that in. But about 90% of our patients, with what we have in office, we would have enough information to order a decent first lens for.
Right, absolutely. And then touch base on...
This is our custom stable product through Valley Contacts, and this product is one that we mostly use for diseased eyes that are misshapen, patients who have had corneal transplants, patients who have keratoconus, just something that's off with the eye. And it's a wonderful thing that these lenses can just bring vision back to patients who, with glasses or regular contacts, just really cannot see based upon their anatomy. And we put these lenses on, and they can read down to the 20/20 line in a lot of cases. I've had so many patients sitting in my office just get teary-eyed because they couldn't see before we put these on.
Well, and that brings it up to you saying, this may not be the right power. I can recall so many patients saying, like, I could leave here right now with this and be fine.
And
you're like, well, there's
happy.
some major tweaking that needs to happen. So if you're happy right now, you're going to be thrilled when the next lens comes
and that
in
happens
because they're
so
just
often.
It does, and it feels good. So do we want to get one of these out and kind of show them
what they look like?
Yeah. Go ahead and pull this out. Now, too, when we order these, they come in, one will be completely clear. One has a very, very slight blue tint to it so that you can decipher between the two if you were to get them mixed up. It kind of helps you figure out which one is which. But see if we can get this. So this is a scleral lens. And again, all of these will be different shapes and sizes depending on the fit for your eye. But they are hard. Some ASMR real quick. I don't know if you can hear that. So this is the contact lens. Now, we do have some patients who insert with their finger.
You can, but there are also some tools made for this, which I think is kind of neat too, because when I was wearing soft contacts, I always hated putting my fingers in my eye to remove the contact. So with these contacts, we actually have some tools that help us with that. So, we have an insertion tool where we lay the contact lens on top, and then we use that to fill it full of fluid, and then this is kind of helps us hold it and guide it into the eye. Now, the one that I like the best is when we go to remove this, we have a smaller suction cup that we can place right onto the lens, and that's just going to help us to gently pull that lens right off the eye. So we're not working with our fingers, our hands clean, or we're putting bacteria in. We're able to kind of keep things a little bit cleaner, a little bit
And I have had to remove mine once with my finger because I did not have my tools with me. I've learned a lesson. I keep extra tools on me all the time. But I did something, I don't even know what I did, but somehow I'd gotten a bubble underneath my contact. And I'd used the edge of my fingernail to flip it off. It was not
fun.
Not fun.
You
so
can do it.
These are amazing. But yeah, it's doable to do that. And we have people who prefer that method. And then we also have people who prefer to use their finger just like a regular contact to put it in. But the problem is because these are hard, they're stiff. So they do rock back and forth on the finger, which is why you want something that is kind of a bowl shape, if you can tell right there, that it's going to sit down in. Because once you start putting solution to that too, it's going to add weight, which is going to cause it to be off balance. But There's even a different tool that I think a couple of our patients have that's like a little ring on the finger that's also cupped.
Yeah, it
right?
looks like a little O-ring that you just kind of set on your finger, so that's going to help balance that contact lens, and then when you put it on, you can fill it up, and that gives you more of the,
That
if you're
natural-
used to soft contact lenses, it's more of that kind of motion and
Right.
feel. And so that's perfectly fine. There's so many different ways to do this. We train our patients, one or two different ways here,
Right.
but there are tons of ways
support
to
groups
do
out
this.
there. I know a lot of our patients talk about Facebook groups that they're a part of or things that they've researched online. I know we have Miss Daspit, who has done many videos showing her
has,
insertion
yeah.
and removal and talking about her lenses, which I think is fantastic. But a lot of people lean to the internet for suggestions if they're struggling. But we do teach you several different ways because not everybody's going to learn the same, and not one way will work for the other person. So we have a couple different ways, and then like I said, just about all of us that work with the scleral lenses wear them and have
Right.
them. So we also have the ways that we know worked best for us when we were learning too.
And we also remember how it was when we were learning to
Absolutely.
put these lenses in. And so, yes, it's a little bit of a difficult process in the beginning. It takes about a week of constant kind of in and out. And, you may even have the thoughts of, why am I doing this while you're going that route?
Yeah.
But all of a sudden it clicks and you're there, and now you can
Right.
take them out, put them in as walking up and down a hallway, just
Sure.
like you probably could with your regular contacts.
Sure.
We even have some patients who have limited mobility that can still do these
Oh, yeah.
contacts.
Mhm.
They make stands that you can set the contact lens
Oh, I
up
forgot to
on.
bring a stand
Yeah,
in
we didn't
here.
bring one in.
Sorry.
But they make a stand that you can set the contact lens on, so that you can use both hands to hold your eyelids out of the way
Yes.
and do that. And so we have tons of patients that use that protocol to do it, and that's perfectly
There is
okay.
a video on our Facebook page, though, that you could go back to reference. One of our promotional videos where you can see a stand that we're using. So it's just a clear stand that you would sit this down into and then put the contact on. That way you can use both hands to keep your lids open if you're not able to keep them open. And then you would just lower your head to that contact lens. So you can actually watch that on the video that we have on there.
Yeah, I think we have it on Facebook. I think we also have a video on our website too.
Yes,
Yeah.
you're right. This is the little kit that you get when your first contact comes in. It's got your storage solution here. It's called Unique pH. So the solution that you store these lenses in is different than the solution that you would use for your soft contacts. This is a thicker, almost kind of has a slimy feel to it.
It does, yeah.
And so this keeps the contact conditioned, and there's actually a coating that we put on these contacts. I'll let you talk about that.
Yeah, so the coating is called HydroPeg, and what it is it's a very slick, lubricated coating that sticks to the lens, and it doesn't wash off very easily. And so when we have that coating on, that's just going to really be there to help the eyelids as they're moving across that contact. And it really helps with our dry eye patients. I mean, most of the time we're doing this for our dry eye patients because our tear film's not in the greatest of shape, and so we can kind of take that part out of it and have that lubricated coating so that we don't feel like we're dragging or being dry and that sort of thing. That coating can be reapplied. So we actually have, I think we have a product here. This is called Tangible Boost. You have it backwards. Tangible Boost. And so that allows us to reapply the very slick coating. So about once a month, once every 60 days, you would soak your lenses in that just to reapply that lubricative coating.
And I think I told you I still need the boost, but the contacts are so comfortable, like we keep talking about, that you don't even realize it has come off until you put it back on, and you're like, oh, okay, actually it did come off, but it was still super comfortable, like.
Oh yeah, we did these contacts for a long time without having the HydroPeg or the Tangible Boost, and they were comfortable then too. With a good fit, the lens is going to be comfortable. It just the HydroPeg and the Tangible Boost really help our dry eye patients. Kind of the mechanism behind that. I know we jumped right into how we use these, but why this works so well is that you have this bowl and we fill it full of artificial tears, and that's what's going to be touching the cornea when the lens is in. Not only that, but it's also going to move the eyelid off of the cornea. So now as you're opening and closing and blinking, that eyelid's no longer rubbing the cornea. And so that's another big component, of why this works well for our dry eye patients.
Sure.
And then we have that coating that helps as well.
So the solution that we talk about that you're feeling the contact with, it's not this solution. It's not the solution you find for your soft contacts. These are preservative-free vials. and they look like this. There's a couple of different, we have Lacropure, which we use and sell
mostly.
here.
Mm-hmm.
This is Nutrafil. And then
there's a Scleral Fill by Bausch & Lomb. You can also use what's called an Addi-Pack. So any of our patients who have nebulizers, it's the same solution that goes in the nebulizers, the little pink vials that you can get for that. Right. Those work pretty well too.
Preservative free is key.
It has to be preservative free.
Yes.
Yeah, and you definitely don't want a preservative free in a big bottle, because then you can start getting bacteria and stuff like that to build up in it, because there's not.
I think we talked about that. I'm like, how can preservative free be in a bottle? But I can't remember what we said. It doesn't matter. So additionally in your kit, so you're going to get your solution that you'll store it in. You're going to get your little sample packs of your fill. You'll also have a little compact mirror, because these contacts cannot be put in like a normal contact. You can't lift it up like this and put it in, because all your solution is going to fall out. So your head has to be at a downward angle. So some people like to use a mirror so that they can see what they're doing. I myself, we cut holes in the bottom of our plungers. These plungers come with a full bottom on them. There's one in here. And the reason for that is to help you suction. I don't know if you can see that. So it comes with a full bottom, no hole. But the reason it comes that way is because when you're using these, some people feel like they need, like if I were to try to, use this, it's going to flop off of there. If you squeeze this before you put it on there, the contact's stuck. The problem is you also have to remember to squeeze it when you get it on the eye to release. And there's so many steps putting this in that I feel like it just boggles patients' brains when they're like, why isn't it coming off? Because they're forgetting to release that, or they accidentally did it and they didn't realize they did.
I also think that when we cut that bottom off to allow the opening there, it gives the patient something to look at. And if you're able to look through that opening and pick something between that, you're automatically lining up your eye. You're centering your eye over that contact. And I think that that's kind of one of the huge things that allows our patients to start getting these in and out.
My ADHD got a hold of me, because that's where I was going with that, and then I got off topic. But I don't like to use a mirror, and I do recommend my patients not using one if they're comfortable, because sometimes the mirror can throw you off when you're trying to see it, but this is all in your way and you can't see your eyeball. You're moving your head to the side to see that, which is causing you to become offline. So yes, looking through the hole of this
and just picking a
and
spot.
lining yourself up. If you can see straight through that hole, you're gonna be lined up. The question is making sure that your lids are wide enough. But if you can see straight through that, you know that you're lined up. Otherwise, you're going to hit yourself in the eye where it shouldn't be hitting, and it's not going to want to stay.
But these are all the things that we work with our patients through, after that initial fit, and when we're coming back in, usually on that first lens that we've done, we'll work with our patients for as long as it takes, but we'll work with them to make sure, most importantly, that we can take the lens out, and then as we can get the lens in. It is very important to be able to get the lenses in without any air. We don't want an air bubble in there, because an air bubble, again, is going to be just like we're drying out the eye. It's just, we don't need that. We need a solid solution interface there. And so those are the things that we work with you guys as wearing these and that's what just takes practice. A little bit of practice goes a long way with this. We're able to, really get our patients comfortable and able to wear them. That does bring up one point. Sometimes our dry eye patients, we get a little feedback on them that they feel like they might be a little uncomfortable in the beginning. So,
and that's honestly, from my perspective, looking at that, is because your eye is so used to being bone dry that it has gotten. The brain has said this is what's comfortable, because we've gone with that for so long. So the moment we throw lubrication on it, just like if you were to put a dry eye drop in because your eyes felt dry, there's usually a little bit of a burning sensation when you put those in. I know there is for me when I'm not wearing my Scleral. So when your brain and your eyes are getting used to the Scleral and having that lubrication on the eyes all the time, it's going to freak out. Your brain's going to freak out on you and try to tell you that this doesn't feel right, because it's not used to being wet. It's used to being dry.
Yeah, so the brain has, gotten used to the dry feeling, even though we don't like that feeling, and we constantly think about our eyes when it's feeling that way. But when we going from that super dry to now we're adding all of this fluid onto the eye, the brain kind of feels like we're drowning a little bit. And so it's a little weird of a transition, but all of our patients, we encourage them, wear them for a few hours and kind of, ease into that. But once they get to that point where everything's gotten to a normal, everything feels good, I don't think we can pry these contacts out of most of our patients' hands at
not
that
at all.
point.
And then your eyes are wondering why you took the contacts out once you do it. I know mine are like, hey, let's put that back on there, because my tears don't retain on my surface at all, I don't think. One lick. Now, you say the scans say different, but I'm telling you, I don't think that they do. Okay, but these contacts, I wear them from the time I get up until the time I have to go to bed, because as long as I can keep them on, I want them on, because I don't think about my eyes when they're in. But no, they're fantastic lenses, and you're right. We do have patients who will voice that it's hurting or it feels weird, but
in the beginning,
then they, we call them, we check on them, and each day they're like, seems to be getting better, and that's because they're slowly getting their brain used to what is actually normal, not the dryness.
Yeah, and it works out well for those patients. Again, we just have to kind of work our way through that. And, these lenses, even though we're prescribing them and we're doing these lenses to help with these disease processes like dry eye, it's not that we expect you guys as patients to have to wear them all the time. Now, we choose to, and I think that as you're wearing them, you'll get to the point where you like your vision better and it feels a little bit better. But in the beginning, it's okay if we start off wearing them a couple of hours. Mm-hmm. That couple of hours is a couple of hours with moisture on the eye that we didn't have before. And so every time that we're doing that, we're making that ocular surface be better.
Right. Well, and I think the same goes for, if you come here and we fit you for these for dry eye purposes and you've never worn contacts in general, that's another thing. Your eyes just have to get used to that. Our eyes react to things being on them, so that I know I've heard some people say it feels like it's like they're red around the eye, and that's because our eyes like, what is this thing on here? And it's reacting and kind of maybe even just swelling a little bit, or maybe you can make that make more sense. But
so we see that a lot of times in the beginning of our scleral fitting. So when we get that first lens in and we put it on the eye, things may look really, really good. But as we wear those over the course of the next week or two, the tissue that those contacts are sitting on is going to change a little bit. And so when it changes, we have to relook at it and make some changes to our lens, to fit that now compressed tissue or where it's going to be. And so again, that kind of goes to why we need multiple lenses, and that's why the companies give us so many days to perfect this fit. When we're swapping out lenses and going back and forth, that doesn't cost our patient anything. That's all included in that upfront fitting.
Right.
And so that's the nice thing, that we're able to have plenty of time to allow the eye to get adapted to the lenses, have everything sit where it's going to sit, and then be able to get that final set of lenses that you can wear for FDA cleared for a year.
Yeah. That's going to be the next question. They last a year.
They last a year, and we do like to replace them every year. One of the things that we have found, because people can tend to wear these lenses a little bit longer, but we have found that it can be a little harder for us on that second fit, that second year. If they've gone 2 years, or I'm not saying we've had patients push it longer than that, but we may have had patients push it longer than that. But when we're coming back in, what we've noticed is that the lenses, we can order the exact same lens and it may not fit as well. And so really and truly, that sweet spot is at 1 year. Sure. We really need to replace those at 1 year so that the eye stays healthy, nothing's changing, we're able to...
But also that material itself, even though they're glass, this material is going to be breaking down from environmental things that we're doing and whatnot. And so it gets more fragile, and there's more chance, more likelihood that it could break or crack, or something could happen with just your normal everyday handling.
Yeah, and so they're plastic. They're a version of plastic that allows a lot of oxygen to transmit through. But they just like any material, they're going to break down over time. And as they break down, they become more brittle. And so eventually you'd be cleaning them and they'll just kind of fall apart in your hands. And so, most of our scleral lens patients would not want to go a single day without having their lenses. No. And so it's, again, important to to keep them up to date so that we're not having any of that.
The way you did your hand saying cleaning them, that also brought me to, we have some patients who say, they'll be like, it's all of a sudden very hazy, foggy, like nothing looks clear. And, just like with soft contact lenses, calcium can build up on those, or protein from, our eyes can build up on the contacts, and it may not come off in a regular soak or just a regular scrub, so we use... not tangible, we use
Progent
cleaning.
Thank you. And we typically do that in office, although you can buy that as a consumer, but it's a pretty strong cleaning agent. And
very strict. way to clean
the
those.
timing's got to be just right. So we encourage our patients to come back to us. We'll do that for you and get them kind of refreshed and ready to go.
Yeah.
But most of the time, your typical cleaning at home, you're going to be able to handle most things, especially if you're keeping up with the tangible boost. That's also going to help to keep proteins and stuff from building up.
Yeah, keep that slicker surface. So we had a patient ask, they thought daily lenses were supposed to help with their dry eye. So let's kind of touch base on that question that they had to see why would you say that the dailies wouldn't work for them for dry eye purposes?
Yeah, it's a really good question. So, daily lenses are probably the best way to go as far as soft contacts are there. So especially with dryness, but even without dryness, it's just a healthier kind of mode of contact lenses. And so with our daily lenses, we still have the issue with some of our moderate to severe dry eye patients. And the reason for that is when we put a soft contact lens, whether it's daily or monthly, we put that on the eye, we're actually splitting the tear film into two parts. Part of it's going to go on the outside of that contact lens, and part of it's going to go in between your cornea and the contact lens. And so if we've already have a not so healthy and normal tear film, then we're splitting it into two. We're really kind of struggling to get that entire day of comfort out of that. And so what you'll probably notice a lot of times is that you put your daily contact lens in the morning, it feels pretty good, but a few hours into the day or towards the afternoon, it's really, you'll do anything to take that contact lens off.
There's your sign.
And that's where it's just that tear film's not able to keep up.
Yeah.
By doing the scleral contact lenses, we're taking that tear film that we were splitting into two, and we're leaving it whole on the outside of the contact lens. We're also not moving up and down across that cornea, because the soft lenses will move a little bit. We want them to move a little bit.
Right.
But we're taking that component away. So it's just really a very different way of thinking about contacts and thinking about how our eyes and our tear film interact with that.
Yeah. So, and I can relate to that question because I actually started wearing the dailies. I had LASIK, had a little bit of my astigmatism come back. So I started to correct it with a daily wear lens, and I would put it in, and probably about 9:30 want to claw my eyes out. Like I would be itching, they would be red, and when I would take it out, it would be so tacky, just
you
dry.
could tell it was dry.
Absolutely,
it just absorbed everything it could.
I even tried doing the preservative-free dry eye drop in it before I put it on, but just immediately, it wasn't for me, and so this is where
and there's some great daily soft contact lens options out there, and for a lot of our patients, we can still maintain that. But for some of those patients who just cannot maintain that comfort all day, this is a wonderful option here.
And I know I've had that brought up numerous times by patients. They'll call me like, something prescription-wise isn't working for me. And it's usually, it works great in the morning, but then by X, Y, and Z, it's not great. And then we tell them, it may not be a prescription issue. Get a dry eye drop, put it in, to see if it clears it up. And sure enough, it does. It clears it up if they put something in, and that's because the contact is drying out, which is affecting the prescription of that contact.
Affecting the vision.
Just like we talked about in a prior video about how, glasses prescription can even change if your eyes are dry. So, it's crazy how much our eyes affect our everyday lives if they're dry.
It is. We think about them all the time.
Yeah. All right, so I think the last thing we're going to talk about is coverage on the contacts. Does insurance cover these contacts? Certain vision insurances, VSP, if there is a certain diagnosis, medical diagnosis, along with the fitting, we can file it there, and typically they'll cover the full amount, but it's a very strict coding, so we just have to see, and not many people fall into it, but we do have some that have. If your VSP has a contact lens fit exam to it, you would just pay that flat copay for the fit, and insurance pay the rest of that, and then you would be responsible for whatever the contact cost was. You could also use your standard contact cost with your VSP as well. So there are options through VSP. It is not covered by medical insurance. But with VSP, like I said, there are certain medical diagnosis codes that, if they apply to you, can be used through your VSP for coverage on the contacts and the fit themselves.
Yeah, I think we have to break this down into, there are medical diagnoses that these contact lenses help tremendously on. Dryness being one of those, but dryness kind of falls into this weird category where not many insurance companies pick it up for that.
Yep.
The keratoconus or the corneal transplant patients or patients who just have some sort of disease of the cornea, those are more the medical diagnoses that the insurance companies will look at more often. But even having said that, these contacts are going to be cost range very similar to what a daily wear contact.
And that's what I try to stress to patients too when we talk about that is if you look at what you're paying for your year of
you're not
dailies,
much different. And for some of you guys that just cannot get your soft contacts comfortable, this is an amazing route to go.
Absolutely. Yeah. And I mean, I guess we just, like I said, you don't realize how much your eyes are affecting you. So really got to look at that. Is it worth the cost to be able to live my life in a more comfortable manner and see the way that I want to see or need to see? And I think the answer to that is yes, because I joke all the time, there are so many different things that we can replace. Like, there's artificial arms, artificial legs, there's not an artificial eyeball to be replaced. Like we can put one in there, but it's not going to help you see, right? So eye health is so important, and I think that if there's ever any question on do I spend this, well, if it's going to make the health of your eye, last you the rest of your life, then absolutely. Our eyes should be super important because it's the one thing that they can't help us with if we lose the vision in it, so...
Yeah, I agree. I think it's important, that we look at how we're using our vision and, how we're correcting our vision. A lot of people out there need some type of correction, whether it's for distance, near, or both. These contacts can be an amazing route to go. They're not for everybody. There are some limitations there, but they're awesome for what we do. I even have my wife wearing them, so we're all sold in here.
I'm trying to get the whole family on them. No, I do. When I hear patients complain or talking about certain situations that they're having, I immediately recommend a scleral lens to them. And I've worked with many people in optical, like I said, while I'm doing their glasses and just talking to them and hearing what they have to say about their contacts or just about the glasses in general, who were not aware that the option is there for the sclerals, or just didn't realize that would be something that could help them with what they were complaining about. So I'm very quick to mention that to our patients because I know it's been life-changing for me, both visually and comfort-wise.
And I think one last thing that I'd like to add is just, the success of these lenses for our patient really is going to come down to getting a good quality fit. And that's going to include several visits back and forth to us. So, we try to be upfront with that. We want you to know that it's typically not going to be a one and done. We're going to need to see you several times. We're going to need to make some small changes to make sure that these lenses are fit correctly. And I think that goes back to, many practitioners fit these type lenses. Some don't, but there are a lot that do. We here at the Dry Eye Center of Alabama, we fit somewhere around 700 of these lenses each year. So it's a lot. It's a ton compared to most practices there. But they're just make sure that if you're looking into these lenses, just make sure that the fitter that you're using just has the knowledge and that can will spend the time with you to get them what they need to be.
Absolutely. All right. Well, that's all for us today. If you have any questions about anything that you heard in the video that you would like to ask, you can either call our office or you can send us a message and we'll be happy to respond to you here. I think next week I'll be here with Dr. McKelvey talking about myopia control, and I think we might dabble into vision therapy too. I can't remember if that's on.
I think so. I think they're doing myopia control, vision therapy, and just kind of general back to school. What do our kids need for their eye health and
I
that
think
sort of
just
thing. So I think
when do my children need to come to the eye doctor? All things children, pediatric. Yay!
That's right.
All right. Thanks, guys, for joining us, and everybody have a good day.
Thank you.
Bye. Oh, I gotta lean up there. Okay, bye.